All right. So we're going to go ahead and get today's panel discussion featuring physical therapists started. I'll begin by asking this question of our panelists. Could you each please introduce yourself and talk a little bit about your educational and career path? Can we start with you, Teresa?
Sorry. Sure. My name is Teresa Notestein, and I am the manager at the clinical practice location for Washington PT at the Rehab Institute of St. Louis. We mainly see patients with neurological conditions. I am someone who knew I wanted to do physical therapy when I was in high school. And so I actually went into a freshman entry program, and I went to Boston University for undergrad and PT school. I got my DPT from there. I'm from St. Louis, and I moved back here. And I really loved every area of physical therapy. I had interest in peds, in ortho, in neuro, but I felt like I hadn't had that much experience in the neuro side of things. And so I really wanted to get a job there when I started. So I got a job at the Rehab Institute in their outpatient department, and sort of the rest is history. I fell in love with this patient population, and it's been where I've been for 12 years now.
All right. Thanks, Teresa. Chris, could you answer that same question?
Yeah. So I'm Chris Gordon. I'm a physical therapist at our 4444 location. I specialize in the rotational athletes. So whether you're a golf player, baseball, softball, I kind of focus more on that, as well as patients with TOS. My background's a little different. I do not have an undergraduate degree in PT. I actually went to Murray State University in Kentucky. It's a very small school on the boot heel of Kentucky. We're usually known for our basketball, March Madness spoilers. And I actually got a degree in PR, and I lived in Chicago for about 7 years, where I worked in advertising and PR up there. I was a baseball player at Murray, so I had a lot of PT, a lot of injuries, and I always wanted to kind of go into that world, and I just never could. And then finally I decided business was not for me, and I went back to school at University of Missouri, and I got my DPT degree. And I've had a couple different areas I've studied in. I've done neuro, so I used to be a spinal cord injury specialist for a while. And then I just decided the ortho world is kind of where I belonged, and the rest is history. So.
All right. Thank you. Nikki.
Hi, everybody. My name is Nikki Erbes, and I am a physical therapist also at the outpatient location for WashU at the Rehab Institute. And I actually knew in high school that I wanted a career in something that had to do with women's health and women's issues. And I thought a lot about going to med school because I also was really interested in science. And to me, becoming a doctor was like the only healthcare option that I really knew about. And so in high school, I took the time to explore different careers, and I was able to have discussions with some physicians and OBGYN as well as physical therapists. And I kind of just decided that the day-to-day life that I wanted was more of that of the PT. And it wasn't, so I went to undergrad at Valparaiso University, and I got a degree in exercise science and minors in human biology and psychology. And it wasn't until my senior year of undergrad that I actually visited WashU, so I'm a grad of the PT program here, that I learned that pelvic health or women's health was an option for PT. And so the minute I learned that was a specialty, I was like, that's what I'm going to do. That's the way that I can bridge my passion for women's health and physical therapy. So all through PT school, it's been my goal to do that. And I'm actually the women's health resident for WashU. So they take one graduate year, and it's an additional year that I've elected to do where I am treating in the clinic full time, but I also participate in other didactic education, continuing education, and then mentoring as well, because it's kind of a niche practice of PT that you don't get a ton of in PT school. So that is, I do pelvic health and women's health primarily is my caseload.
Steve.
Hi, everyone. I'm Steve Ambler. I'm the Associate Director of our DPT curriculum. And I started at University of Illinois. I got a bachelor's degree in kinesiology. And I went out to Arizona, and I practiced in a small private practice in Phoenix for about 5 years, mostly orthopedics and sports background. And then from there, I went to University of South Florida in Tampa. And sorry, give me 1 second here. Sorry about that. I went to USF, University of South Florida in Tampa, and joined the faculty there, and was kind of working in a role like the others on the panel. I was treating patients most of my time and teaching a little bit, and I went back to school. I got my master's in public health, and then I got my PhD in education there. So I've had kind of an interesting road. Sorry, my DPT is from WashU. Skipped over that part. But it's sort of been an interesting role focused on patient care, and then also how do we organize physical therapy education within higher education. Up until I moved here, which was 2 years ago, I was treating patients. Here, I'll have to treat patients in the pro bono clinic, and hopefully that won't take too much longer to get started. I'm itching to get back to that.
All right. I'd like to ask one of you all to volunteer to answer these two questions. And then if there's additional information that others want to add on, please do so. So the questions are, what are the educational requirements for this profession, and what qualities are admissions committees looking for in candidates? Is there anyone who would like to take that?
I can probably do that one, but everybody here has been through it. So if they have different opinions, I think that would be good too. The educational requirements. So the physical therapy, the entry-level degree, the clinical doctoral degree is a DPT. That's usually about a 3-year program. It does vary a little bit. So now it's anywhere probably from 2 to 3 years and a few months if you looked at programs across the country. And then, as Teresa mentioned, there are a few programs that have a freshman admit path, and maybe she can give more detail on that. So again, you start as a freshman and then work up from there. What admissions committees look at varies a bit in PT. And I mean, everybody has prerequisites that they require. Most programs require a minimum GPA, and although not all of them. And then usually some variation of other kinds of questions, essays to try to figure out who you are, and learn about you and how you would fit into their program. The reason I say it varies quite a bit, and I think more than it ever has, is because PT, like medicine and pharmacy and a lot of the other health professions, has slowly, probably more slowly than needed, but has slowly been moving to more holistic admissions practices that really seek to take into account every individual and their life experiences, and to try to reduce some of the things that traditionally have been barriers to really creating a diverse workforce. And so, for example, we no longer require the GRE, but a lot of programs still do. We've also tried to broaden greatly our prerequisites. So you need a science background to some degree, so that you can be successful in the programs, because you don't want to jump in and not be prepared. But we've learned that people can get that background a lot of different ways if we just take the time in our admissions process to learn about how they've gotten there. So it varies quite a bit, but I would say the most common degrees are still like Nikki's, so exercise science, kinesiology, athletic training, biology, and some of the other sciences. But we have dance majors, Spanish majors. We have no degree requirement other than you have to have a bachelor's degree and then have passed our prerequisite courses. And that also is pretty common across the country. I'll pause, and there might be more specific questions about that, but also just to let others comment on their experiences of applying to PT school, or Teresa, maybe the different path your program was.
Okay. Would anyone else like to share on that topic? Okay, if not, we're moving on. So we've heard from Steve a great overview of the requirements for applying to PT school. I'd love to hear from you all about your own personal experience with your graduate degree. What aspects of the program did you find most useful? And then what was most challenging for you? Nikki, could you begin?
Yeah. I think that the most useful part of this is the clinical experience, right? So that's when you're able to really apply what you've learned in the didactic material to treating patients. And I think different programs space it out differently in their curriculum, but what I loved about WashU is that it was spaced out throughout the 3 years. So we would do a year of learning in the classroom, and then we would spend 8 weeks in the clinic. And then we would go back and do another semester and then go in the clinic. So it was kind of broken up. It wasn't all clustered like at the end. And that was wonderful because, one, it broke up all the material that you're learning, right? And getting you out into the clinic and interacting with patients, which is what we're all there to do. So it kind of kept you engaged and not burnt out, if you will, from learning so much at one time. But then it also gave you the experience of being able to digest little bits of material at a time, right? So it wasn't like you just learned all this stuff and then you have to go and apply everything at once. It's like you take little bits, you get to apply it, and then go back to the classroom and learn more. And I had like a neuro experience before I even had neuro coursework. And so I was able to, one, learn a lot in the clinic, but then kind of come back and think about critically, okay, what could I have done differently, and kind of approach it from a different perspective, if you will. So that's what I loved the most. I think the most challenging things is that it's a lot of material. So it's kind of like shoving a watermelon down a straw sometimes a little bit. So it's a lot of material, but I think if PT is your passion, you're there because you want to learn all of that, and it's so worth it. And but it is a lot. So.
All right, thank you. Chris.
There it is. Yeah, so kind of like off of what Nikki was saying, you know, at Mizzou, we did the same way, where you did a year of learning and then you had 5 clinicals dispersed for those remaining 2 years. And so you got some basic information to start off with, but then you were able to incorporate that into your clinical education experiences. The biggest thing, whether it's WashU, Mizzou, the class that you come in with, you'll be with for 3 years. So what I enjoyed about it is that the people in your class became like your smaller family. Well, it's not a small family, it's a big family, depending upon your class size, but that you know you're all were in it together. Everybody had questions, you know, you were there for each other. You would always have little small gatherings outside the classroom just to kind of blow off steam, but that really was a family orientation when you're in PT school. And I always encourage current students to always, you know, to embrace that and just enjoy the time that you're in school with, because it flies by. 3 years definitely goes by fast, and you'll enjoy those relationships that you made when you were in school, and you'll be able to share some stories afterwards. The challenge would be kind of like what Nikki said. It is a lot of material. You just have to prepare yourself not to get overwhelmed. There will be some things that make sense and some things that don't make sense. I still remember I was tasked with trying to teach physics for the laser modality stuff, and it was a nightmare. And I will always be scarred for that. But it was fun and interesting trying to do some of these things. But it's a lot of information. You'll learn it, you'll integrate it, and then you'll be able to incorporate it in whatever clinical practice you want to get into.
Thanks, Kristopher. Teresa, could you answer that question, please?
Sure. I agree with everything that Chris and Nikki said. And in addition, you know, the thing that I think was the most useful thing about PT school is that they really teach you how to think. So it's not necessarily you're going to see a patient X in the clinic and the answer is Y, because every patient's going to be different, and you're going to have somebody with the exact same diagnosis walk in and they're going to require a completely different treatment plan. But what you learn to integrate over those 3 years is, okay, well, how do I apply this breadth of knowledge to a patient who's walking in, and how do I make it so it's customized and individual to that patient to help them improve? And I've always just thought that was really great, because nothing's cookie cutter in physical therapy, but once you start to understand, you find it interesting when someone comes in and presents completely differently with the same diagnosis.
Right. Steve, do you have anything you'd like to share on this topic?
Well, what stuck out so much to me was what Chris said about, I mean, you go to these programs and you're with this same group for 3 years. And we used to joke that, so we had PT school together, and then we had 3 or 4 years of going to everybody's weddings, and then it was, well, anyway, so you make close connections for life. And that was so great. And that's, you know, that's at every program. I think one of the challenges for some, it's different for everyone. So I get asked all the time about how to prepare, you know, or what's the hardest part, what's the best part. And I try to emphasize to students that it's different for people. I mean, we have, and they have different experiences. We have some students that come in and the foundational science courses are not too difficult for them. They've had a degree in a related science and they're ready to go in that area. And then they struggle with talking to patients the first time. You know, it's something they've never done. We have other students that come in and they were an EMT and went back to get their prereqs, and they're brushing up on, you know, physics, for example. And, but they are amazing with patients. And so students help each other out, and they kind of then all get to the same place in the end. So what you're looking for is a place that recognizes those differences and seeks to kind of bring people together on them.
All right, let's talk a little bit of day in the life or week in the life. So what is it that you're doing on a day-to-day basis? Could you share a little bit about your daily tasks and skills that you use, and even do some comparing and contrasting between possibly different specialties, if there are any differences between what you're doing or the amount of time you spend doing X versus Y? Chris, could I start with you, please?
So obviously, you know, things have changed since March regarding you know, what our day, our week, and our, you know, daily activities include. So I primarily, most of my time is spent as a clinical physical therapist. So I just see, you know, 8-9 patients a day kind of thing. Varying diagnoses, varying issues. I primarily work in orthopedics though, so a lot of, you know, joint issues and pain going on. Some of my tasks have changed here recently within the last few months. So I now work with Jenny Moore for marketing to bring in new specialty programs to 4444, which includes a brand new golf performance program we just have started to roll out. And I also help with a lot of lab assisting and mentoring or grading of different courses. So every day is different. You know, every day is unique and has its own challenges, but overall, the career that we've chosen for PT is very fulfilling, and it's something that, I love doing. So.
Okay. Teresa, how do you spend your day or your weeks? What are you doing? What are you up to?
So I'm a manager, so I actually treat patients 30% of the time, and then 70% of the time is doing different management tasks, from all kinds of things like marketing, schedule planning, managing vacation, kind of run it the full gamut. During my patient care time, my focus has always been neurological physical therapy, with especially kind of another focus in on stroke and brain injury. I've really had a passion for brain injury since I started in physical therapy, and I see patients really who run the gamut. So everything from concussion and post-concussive syndrome, things like dizziness and headache, to really severe brain injuries, individuals who have a lot of agitation, difficulty with their movements, things like that. I love it because it's all different. So sometimes the focus is really going to be on education to a family member, or how to improve a caregiver's ability to care for their loved one. And everything from really high, like I had a patient out in the gym today running sprints, doing jump squats, doing burpees. So I'm kind of running the full gamut. So everything's different, but that also helps me feel like I can keep my skills up and keeps things really interesting.
All right. Steve, could you share, please?
Well, my days right now, well, all of our days, and by the way, I'm up in the playroom. The background is not as good, but it's a little quieter. And so, sorry about the noise earlier. My day is mostly administrative duties related to our curriculum. And so we talked about admissions. I oversee that process, the curriculum itself, which is the bulk of the work and the time. So the organization of our content, our courses, when they are, where they are in the curriculum, and how all of that should be structured. And then sort of the evaluation, the continuous evaluation of our curriculum, student outcomes, licensure, et cetera. So it's heavy academic administration right now, and that includes some interprofessional involvement within our School of Medicine. So it's a wonderful environment with a lot going on. I have some teaching where I work with the students that are in our current curriculum. And then I already mentioned a little bit about patient care that, hopefully that will be returning soon in my role. And I just wanted to mention that I've been in about every sort of area of, whether it's patient care all day, or some of these models where you're doing a little bit of both, or a little bit of 3 or 4 things. And so overall in PT, it is very flexible. I think you can find different areas, and we've heard about some specific specialty areas across, others here that have commented. But you can also sort of grow into different areas over time. And it's one of the things that I've always really loved about PT. When I started out, it was patient care all day, and I was new. And so it was sort of, really long clinic days, and because I wasn't very efficient either in the beginning. And so I worked all the time. And then that varied into management roles. And we haven't even talked, other than Nikki's example of pelvic health, we haven't talked that much about some of the specialty areas yet, which also brings different daily schedules and activities. So lots of variability.
Would you like to touch on that right now, Steve, a little bit about some of the specialties and how the roles are different at all?
I can, and then maybe folks can talk about their specific area. My board certification is in orthopedics, and I spent most of my practice time in orthopedics and working with high school athletic teams out in Arizona, and then a little bit with minor league baseball. And that, that was very different than, we have specialty areas across orthopedics, neurology, pediatrics, geriatrics. Nikki mentioned women's health or pelvic health. And, there's a number of other specialty areas. And then also outside of those specialty areas, there are just a number of different practice settings, hospital settings, outpatient, ambulatory centers, school systems, work-based clinics. So I'm going to miss them. I'm not going to get them all if I just try to.
That's okay.
List. But maybe others could talk too about their specialty areas and then add on the other ones that I didn't just ramble off. Or if any of the other visitors today have questions about specific areas, that would be great too.
Okay, wonderful. And Nikki, I don't think I asked you about a day or a week in the life, did I?
No, not yet. So I
Okay.
can share that.
So, yes, please
Um,
share about that, and also touch on what Steve said around specialties as well.
Great. So right now, I am treating full-time in the clinic, and then for part of my residency curriculum as well, I'm working on some additional projects that I typically work on over the weekend. And that includes working with some of my mentors and a PhD student. We're currently writing a manuscript for publication. So I get to be a part of some research, which is really cool. As a pelvic health physical therapist, what that really means, and with this specialty, is that I'm specializing in working with musculoskeletal conditions of the pelvic floor, but even beyond that, the whole kind of lower quarter, if you will. So I do a lot of musculoskeletal assessment of the spine and hips, because that can impact pelvic floor function. So typical caseloads that I'm getting are patients who have urinary or bowel or sexual dysfunction, as well as pain conditions during pregnancy and the postpartum period as well. So kind of looking at all of that specific area of practice.
Okay. Chris, did you want to say anything in particular about specialty?
So yeah, I mean, you can go into a lot of different areas in PT. So I don't have a specific board certification. I just work with a lot of athletes. And so I have subspecialties. So I have different certifications. And for example, I'm what they call TPI certified. So it's Titleist Performance Institute for golfers. I'm also on base U hitting and pitching certified to work with baseball and softball players. So I've been able to work with some pro athletes, which is very cool. And I've been able to work with novice athletes. So no matter whatever you want to go into, you'll always find another subspecialty that has additional certifications that you can kind of get. So there is a ton of things out there for PT, and no matter what area you want to go into, I always say you'll find your home. You'll roam around there a little bit and see, and you'll dabble here and there to see what interests you the most. I did spinal cords, I did vestibular, I've done a whole bunch of things, and then I figured out for me, sports for baseball players, rotational athletes is kind of where I found my home at. So that's what I mostly focus on.
Teresa, did you want to share something?
Well, I was just going to say, to piggyback on what Steve said, because I thought that was a really good point, that there can end up being a lot of flexibility even outside of the specialties. So prior to taking this position, I was actually doing part-time patient care and working part-time with a research study. So it was just really interesting to collaborate and kind of use my skills from physical therapy in designing a research study, and then also kind of implementing the protocol within that research study, and working with people outside of my discipline. So I value that, and I have other friends who have moved on to working with, startup companies for different technology devices or things like that. So there are definitely various directions to go.
Okay. And I'll ask this question and someone can volunteer to answer it. Is there an interesting case you could talk about, or even just a typical case? I think sometimes when clinicians say, oh, I'm doing clinical work, people don't quite understand what that means. Like, what happens when you see a patient for the first time? What are you doing with them? When you see them at subsequent points, what are you doing with them? How do you interact with like cross-disciplinary teams? Like, what are the skills that you're using? I know that's a whole lot, but could you paint a picture to give the students and alumni a sense of the skills that you use, how you interact with patients, that sort of thing? Would anyone like to take this one, and then someone else can throw other things in if they wish?
I'll talk about an interesting case. So it was kind of when I was first starting off, when I was a therapist, the first few months out, I was seeing a patient that just had a referral of shoulder pain. And so I was doing the basic things you would do with a patient that has that kind of diagnosis, but she wasn't getting better. There was something off about how she was presenting. And so I remember her saying that whenever she laid on her arm, it felt better. Her pain was gone. But whenever she stood up and tried to move her arm, the pain was back. And so there was just something that stood out. And when you're in PT school, you'll take a class called differential diagnosis that kind of takes you through the different systems, certain pain, certain organs will refer pain different areas. And so I had her go back to her primary, and they eventually ordered a CT scan, which showed a tumor of her lung. So she ended up having a Pancoast tumor, which is a serious thing, but she was able to catch it early enough to have it taken care of and to have it evaluated. So that's the one thing that continuously sticks out to me as I continue to practice, is just because, you know, a doctor gives you something for shoulder or neck pain, don't think it's just that. Always look at other things that might be attributing to what their issues might be. Treat the whole person and not just the body part, is what I tell people.
Okay. Anyone else?
I can talk a little bit about typical. So from my perspective in neurology, I would say probably between 30 and 50% of all the patients that are referred to us have a diagnosis of stroke. And that can look very different, but for everyone, we do what we call an initial evaluation, where we perform different tests and measures, things like manual muscle testing to look at a person's strength, and other objective measures that look more at function. So their balance, whether that's static or dynamic, their ability to walk certain distances, and kind of looking at them compared to normative data. And then specifically talking to the patient about what their goals are, because that varies widely. And so the initial evaluation is typically a conversation between the therapist and the patient about how we can work towards that patient's goals. And then we identify goals and work towards that over time in subsequent visits, always kind of focused on that, how we can assist the patient to achieve those goals. And in neurology, I'm typically working very closely with other disciplines. So I work with speech and occupational therapists who both work within this clinic, and we collaborate, whether that's on swallowing strategies when I give them a drink of water in physical therapy, or standing endurance that I ask an occupational therapist to work on. So we always try to work across discipline to help the patients meet their goals as well as possible. And then also working very closely with their physicians, because we're the ones typically with eyes on the patients, you know, at least once a week. We're able to monitor their blood pressure, refer back to the physician as necessary, and things like that. So it's really a team approach.
I can comment a little from my perspective, because it's a little different. But along the same lines as what Teresa said, if a patient came for their first evaluation, I would spend a lot of time kind of hearing from them, you know, asking questions about past medical history, what symptoms they're having, and then doing various tests and measures to determine what's going on. And what that looks like for me is I always do a movement exam. So I like to see how they're moving in their spine and in their hips. We'll look at different range of motion of the spine and the hips to determine if there are other structures involved than just the pelvic floor, we'll say. And also doing different muscle testing to see what's potentially contributing. And then depending on what the patient's complaints are, so we'll say like a typical patient that I would see maybe is a postpartum mom who has stress urinary incontinence. So they're leaking urine when they cough, sneeze, or laugh. I always do my movement assessment, and then I can also perform a pelvic floor muscle exam. So that's an actual internal assessment that allows me to determine a patient's ability to contract their pelvic floor and just to see how their pelvic floor is functioning kind of at baseline. And then we'll be able to actually work on those muscles specifically in treatment. And it's a lot of it's like a giant puzzle. It's putting all the pieces together to figure out how to change the person's symptoms. So I address function a lot. So what are they doing in their everyday activities that could be driving dysfunction, whether that's movement or symptom related. So that's kind of what a typical exam would look like for me.
Okay. I'm going to pause on my question asking and allow the students and alumni to answer questions now. So in terms of how you can go about answering a question, asking a question rather, you can type a message in the chat bar or field, or you can use the raise your hand function or physically raise your hand. So if there are any questions, please ask them at this time. Okay, I'll wait a few more seconds to see if anyone has a question. Okay, it looks like there aren't any questions right now, which means the panel is doing a great job of explaining a lot of great information about the field of PT. This is a question that's not on you all's question list, but students often ask me this, and so I'm going to pose it to you all. What is the difference between being a PT and an OT? Would someone like to take that?
I can take it because I work very closely with occupational therapists and have for a long time. So there's a lot of crossover, and we work in collaboration with each other. Typically what you see within a clinic, especially in neuro, is going to be that PTs are focusing more on functional movement like walking, transfers, ability to move in bed, balance. And on the flip side, in OT, often there's more of an upper extremity focus, even though PTs, depending on what area of specialty you're in, do a lot of upper extremity as well. But they'll focus on things called ADLs, activities of daily living. So how is the patient able to eat? Are they able to use the restroom? And helping them to get strategies to use that independently. They also work on things like dexterity and patient's ability to write. And then in OT, there's also the cognitive piece. So they're working on functional cognition, like the ability to pay bills, organize their calendar, take their medication appropriately, and things like that.
All right. I just have a couple of other questions before we close today's session. And the first of the two is, what would you say are the rewards and challenges of working in this profession? Could I start with you, please, Steve?
Sure. I mean, I think the most rewarding things are working with patients and seeing them improve, and in any of the settings we've talked about, those are some of the most fun times when I think about, the different areas I've been involved in, and also working with the other professionals. So I've just, I've joked with a lot of my friends that I went to college with, that I've never had an office job, and I just have always loved being in, whether it was the outpatient setting or the hospital, a whole bunch of people working together with patients. It's sort of, every day is different. There's lots of challenges. It can be long days. It can be tiring, especially when you first get started. But I just find the reward of working with patients and sometimes connecting with them years later. I've gotten messages from people, and that is by far the greatest thing. Now, for me, the other thing, now almost 10 years being in PT programs, it's a similar kind of experience with the students. So now, I get to keep in touch with students over many years and all the neat things that they're doing in the field. I do think some of the common challenges are, depending on the setting you're in any healthcare field, there are challenges with the workload itself. There's insurance that you deal with. There is documentation, so writing your encounter with the patient and making sure you document what happened and what they need so that they can get the coverage they need. Some of the things that when people go into PT, at least when I went into PT, I wasn't thinking about some of those other practice roles that are necessary, but that sometimes take you away from the patients. And of course, that's kind of a growing issue across healthcare.
Right. Nikki, is there anything you'd like to share?
For me, as you can imagine, talking about urinary and bowel issues can be really challenging, and it's very personal for people. And I think a lot of the times people might be reluctant to have those conversations with a healthcare practitioner. But the work that I do, it's so rewarding because I'm giving people strategies to change their outcome. And getting to walk with them in that journey on such a personal matter is just extremely it's so rewarding, that you're having such a tremendous impact on somebody's quality of life, because these things can really be kind of detrimental to how comfortable someone feels, going out in public and spending time with friends, and giving them strategies to change their situation is just extremely exciting. So,
Chris?
Yeah, I would say that, it's cliche to say that we're making people better is kind of what it is. And if you're a PT or if you're interested in going into PT, you want to help people. So whether it might be as a small thing or a big thing. So, my days change every day. So I might be seeing, a pitcher that has to throw a 100-mile-per-hour fastball pain-free at 8 o'clock. And then at 9 o'clock, I have a 85-year-old patient who just wants to raise her arm above her head to get to the kitchen counter. So it's unique, it's interesting, it's always changing. But I think that if you want to go into this profession, you already have that need that you want to be able to help somebody improve their quality of life, like Nikki said, and kind of show them that pain isn't normal. You don't have to live with pain. And that's kind of what we do and what we excel at with being the movement specialists that we are.
All right, Teresa?
And I'll echo what a lot of them have already said. It's just so rewarding to work with patients, in my area of expertise. When I tell people what I do for a living, often people respond and say, that must be so sad. And I never think of it that way. It's incredibly rewarding. I always say people are always their worst the first day they walk in. So all I'm seeing is improvement over time, collaboration with their families, and giving people an outlet and giving people hope. And I love the relationships I build with people. It's just different than maybe with their physician who they see twice a year. They're often coming in to see me 2 or 3 times a week. I become a part of their family. I learn about their grandkids. I've always created that personal relationship with my patients. I think it improves buy-in, and it's really wonderful to get them to commit to the plan and work together to achieve their goals.
All right. It looks as though we have 3 to 4 questions in the chat space, and I'll ask those now. The first one is, what are ways to get involved in research in PT school and do research after PT school? Would anyone like to answer that question?
Oh, go ahead. Okay, I was gonna let you go. Well, the way I got involved was just from creating relationships with physicians, and prior to this, the outpatient program at the Rehab Institute was not part of WashU, but it was still part of the greater BJC system. And so I worked with a lot of WashU physicians. We talked a lot about what we wanted to see in the profession, and I just kind of, the opportunity developed from there. But I think there's a lot of different ways. But I would just encourage, I think if you want to get involved when you're in PT school, people are always looking for help. And so if you're interested, if you're at a school where they're doing research, you should have an opportunity to kind of get involved, even if it's a small way, just to start looking at data or, various small things.
Okay. Does anyone else want to say anything on that topic? How do you get involved after you complete PT school? Is that possible?
Yeah, I mean, it's so variable. So, Teresa's example where you can get involved where you're, employed, as that's part of your work, is doing that. You can get involved in programs where some of the research projects are part of curriculum. In other words, it's part of your working towards your degree. And then in others, it's extra things. We have, in our program, for example, we have assistantships that are sort of awards. So you get paid a stipend to help in research labs, or you can do work study and help in research labs and get paid a little bit along the way. After you get out, also I should mention there are so research master's degrees or also PhD programs linked to DPT programs if you want a career in research later as well. So there are those options for your education. After you get out then, I mean, it depends on the level of research you're going to do and whether it's going to be funded or whether it's going to be patient care research. I would say that once you have your degree, it could be all of the above. I know a lot of therapists that have gotten involved in clinical research where they partner. So they partner with a PhD researcher, help write grants, help do the studies, help collect data, help write the papers, and others that go as far as running their own studies. It's becoming a bit more like medicine, where the MD sort of opened up doors for clinical research without going on for the PhD, and I think you'll see more and more of that in PT moving forward. There's been a push to fund and involve clinicians more in PT research over time.
Okay, I have another question from the chat space. What's something you wish you had known before going into PT school or while applying? Would someone like to answer this question?
I think as a new grad, you don't really think about the relationships that you have to build with your referral sources. So in order to see patients, they have to be referred by a physician. And that takes time, and I'm lucky to be at a place where we have really established referral sources, but I see how hard some of my coworkers have worked and how hard they continue to work to establish that. And sometimes that takes effort outside of when you're just like going to work and treating your patients 40 hours a week. But all the additional things, and we're so thankful for awesome marketing that's in place as well. But even as the provider, you really want to make sure that you have good relationships with the people that are sending you patients.
Okay, I'm going to collapse these 2 questions together because they sort of fit together in the interest of time. Okay, This is more of an admissions question, but I was wondering if WashU or other PT schools have altered their shadowing/volunteer requirements since in-person opportunities have decreased recently. And what would you recommend doing now to look for shadowing opportunities?
I can answer. We don't require it. We've recommended it for a long time, and we just actually deleted any sort of number of recommended hours. We just say it's recommended. So I'll try to answer this directly and not give too much of my own. I think shadowing and volunteering hours, even before COVID and the things that are going on right now, have been harder and harder for students to get. Just facilities just have more and more work to do to get them in, especially inpatient facilities. It's just harder to do. So there was just a survey that went out to all programs last week or the week before about this very question. So, and I've already talked to a number of friends across the country where I know they have made immediate adjustments to these hours for your applications. I don't want to speak for other programs. So you should, if you have programs that you're very interested in, you should contact them early and just ask, because this needs to be a multi-year reduction, in my opinion, right? So even if you weren't going to apply this next round, maybe it's the year after, you still have lost time in being able to collect these hours if they are required by a program. So in general, I think you should see in PT a reduction of these being a requirements anyway. And I think you'll see many, many programs allowing variability in their previous requirements because of the last few months.
Okay. And since shadowing and volunteer opportunities are at a premium or very limited, it seems like even before COVID, what other types of things would you all encourage people to do to try to determine if this is a good fit for them?
Well, and others can come, but that's why we've left it as a recommendation. And so if you can talk to physical therapists, even if you don't get to go to their clinic and see, be able to find someone that you can ask about some of these questions that we've gone through today. Go on the APTA, the American Physical Therapy Association, apta.org. There's a lot of information on that website about the profession and sort of what it's like to be a physical therapist. And so, because I always say this, and this is just my experience, but I didn't personally find the shadowing I did as an undergraduate student to be a foreshadowing of what it was going to be like for me in my career. I've actually worried about it at times, that you go and depending on the place you end up going, you may or may not get to see very much or be around a lot. And so if you are shadowing, try to get different short experiences or talk to more than one person and learn about their experiences versus just trying to go somewhere and get the hours that are required.
Okay. So it's 1 o'clock Central Standard Time. I want to be mindful of everyone's time. And first I want to thank the panelists, Steve, Teresa, Nikki, Kristopher, and then of course, Jennifer for coordinating the group. Thank you all so much for taking time out of your schedules to speak to the students and the alumni. This was extremely helpful. And then for the students and alumni, my name is April Chanel. I am a career advisor and a pre-health advisor at the Career Center. We are open currently. You are welcome to schedule appointments with us online. The majority of the pre-health advisors are in the college office, but they are also there this summer, and you can meet with them online as well. So students and alumni as well, thank you all so much for joining us. And you all have a wonderful day. And thanks again.
Bye.
Bye.